We are joined now by Dr. Ali Hassoun, infectious disease specialist from Huntsville Hospital, to give us a better understanding of the numbers that we're seeing.
Dr. Hassoun, thanks again for joining us tonight.
Oh, thank you for having me.
Well, according to Huntsville Hospital, the number of people getting tested is around 400 to 500 each day. Huntsville Hospital CEO David Spiller said they use that data to help determine how many people are sick. Now, when we compare it to July, when we saw nearly 1,400 people tested in one day, is this a sign we're heading in the right direction?
I think it is a good sign in a way of knowing there is less number to be tested. But the reality at the same time is, you know, as people getting to know about the coronavirus, they pick and choose and decide about if they want to get tested or not. So not a lot of them are really willing to be tested. I've seen people in the hospital refuse to be tested as well. So part of it is a good sign, because I can tell you in the hospital we've seen reduction of cases. So that's some hope coming up. So we've seen it going down, went up again, and went down again. It's going to be variable, and it looks like it's going to stay like that at the moment till we see what's going to happen with opening the schools and playing sports and all that.
One stat that we've been following closely is the number of coronavirus hospitalizations in North Alabama. Tonight, we know there are nearly 120 in the Huntsville hospital system. While this number also decreased over the past month, how concerned should we be?
Yeah, so for us, it is a good sign. There is less pressure on the healthcare system, definitely, and those who work in the hospitals. But what my main concern is, people is having fatigue with wearing masks and doing physical distancing. They might feel they are more safe and secure in compared to what we had in July, where people paid more attention. And then, you know, as we open up more, we're going to probably see more cases. That's very evident in colleges, universities, and other schools that open up. So I am definitely concerned, very cautious about being optimistic, because we're going to need to wait and see how things are going to go with that. The fall is coming, other viruses going to happen as an infection. We'll see how this is going to go.
Yeah, it seems like doctors and hospital officials are the ones that are most concerned. Mr. Spillers, along with some local leaders, said they are concerned about this upcoming holiday weekend, the spike in cases we could see after it. So how dangerous can Labor Day weekend be? And what is your best advice for people who will be heading out to the parks, the beaches, the bars?
I mean, it definitely can be extremely dangerous, because we've seen it with July 4th, you know, holiday. We had significant rise 2 weeks after that. It was, in a way, you know, all the hospitals got full, the ICUs got full almost. So it can be dangerous if the people doesn't follow, again, the basic rules. Because if you're really sick, please stay at home. If you get exposed, get in contact with your regular doctor to be tested and quarantine yourself in the meantime. And then just follow the masking and physical distancing and hand hygiene. Please do that so we can avoid what happened in July. And, you know, we want our kids go to back to school. We want our teachers to be safe. We want everybody have more time to spend with their families and loved ones rather than in the hospitals. So if people really follow these, hopefully we can bypass this holiday without any major issues.
Dr. Hassoun, let's talk about the return to the classroom for a few minutes now. Today we learned 9 students and 5 employees in Colbert County schools tested positive for coronavirus since the start of the school year. That was on August 24th. Other districts have also reported positive cases. So do you expect a major outbreak in schools across the region, or do you think cases here and there will just be part of our new normal?
So I think there's going to be clusters of infection in every school, depending on how much they follow the guideline and how much they plan what to do with infected person or notify others. My main concern is if fall comes in and we have a lot of different viral infections, it's going to be very confusing for everybody. I think the issue is Huntsville schools and Madison schools made it earlier to open up, and that's what's concerned me. I know there is, better picture in the way of less cases, but I think they should have waited a little bit more time to see a little bit of relief more rather than push it where we're going to open September 14, I think.
So, yeah, you said that it's not a smart move, in your opinion, for these schools to open up their brick-and-mortar facilities. And you wouldn't send your child back, correct?
Yeah, I mean, I can tell you, Dan, again, we've seen these cases go down and then went up. And we're talking about what I'm seeing, not just community, hospitalization as well. So we're not out of the COVID widespread infection yet. We are not. So I'm not sure why they made it earlier in compared to, they made the right decision of waiting 9 weeks in the beginning to see how things are going to get better. But we'll see.
Yeah. All right, we have a lot more to discuss with Dr. Hassoun tonight, including the timeline for a coronavirus vaccine.
Stay with us. You are watching WAAY 31 News at 6.